Today I will be performing an intramuscular injection using the Z-Track method. First, I will look at my orders, which is vitamin K, 1 milligram over 1 milliliter, IM, Z-Track times 1 dose. So I will align it with my five rights of medication, ensuring that I have the right medication, which is vitamin K, 1 milligram over 1 milliliter, ensuring that my patient will be Mr. Disembodied, room so-and-so, and the correct dose will be 1 milligram over 1 milliliter, and the correct route will be IM, which is appropriate for this administration, and the method will be Z-Track, and ensuring that the right time and right documentation, such as doctor or physician, putting the name alongside the order. And then I will go into the MAR and check to see if the order is in there as well. And then I will go into the medications room and I will obtain my vitamin K with 1 milligram of 1 milligram of vitamin K. I will also get a 3 milliliter syringe and a 1-inch 23 gauge needle, which is appropriate for the administration, a Band-Aid, and some alcohol wipes. All right, and now I will attach my syringe to my needle. And then I will get an alcohol prep pad. I will perform hand hygiene, and then I will engage my needle, get my alcohol prep pad, wipe off the vial, remove my cap, go in from level down, 45 to 90, insert. I would inject air, but there isn't a lot of pressure here already in here, so I'm just gonna take out my 1 milliliter. I would inject 1 milliliter of air, but there's already a lot of pressure in here, so I'm just gonna do 1 milliliter, just so it doesn't spray everywhere. Ensuring I don't have any air bubbles. Recap my needle. My 1 milliliter. And then I will go into my patient's room. We'll prep my equipment for movement. Then I'll go into my patient's room. Then I will assess that I have the right medication, which is the vitamin K, 1 milligram over 1 milliliter. And then I would, good afternoon, my name is Ginger. I am from UAM. Could you tell me your full name and date of birth? I will give my identifiers for my patient, sure to have the right patient. And then I'll move on to, okay, Mr. Disembodied, I will be injecting your vitamin K intramuscularly. Could you tell me the last site you had it or if you've had it before? Okay, and since this is 1 milliliter, I can inject it into the deltoid and or the vastus lateralis, rectus femoris, or the ventrogluteal. But since it's 1 milliliter, I'll be injecting it into the deltoid. And then I will prep my patient. I will put on my gloves, perform hand hygiene, put on my gloves. I will also ensure that I have the right dose, which is 1 milliliter, and at the right time. And since my site will be the right deltoid, I will wipe from the injection site and outward, wait for it to dry. Uncap my needle, and since I'll be using the Z-Track method, I will pull the skin 1 to 1.5 inch down, and then go in at 90 degrees. Inject the vitamin K. then return the skin fold over. Recap my needle for recycling purposes, but I would engage the safety and then put in the sharps. And then I will assess the need for a Band-Aid or a patented dry, and then I will check my 5 rights again, ensuring that I gave the right medication. Well, I'll ask my patient, I will assess the site for any adverse reactions and monitor for 15 minutes for any adverse reactions. And then I will clean up my area, go to the patient's MAR and document the injection, how much, the patient's name, date of birth, time of the injection, route of the injection, which would be the right deltoid, and the reaction to the administration. And I am done with the intramuscular injection using the Z-Track method.